We did a needs assessment a couple years back as part of our Mental Health Services Act funding, and found that we had a lot of bachelor's level staff who were facing some barriers in getting their master's degrees. And so we asked what those were, and they said transportation, accessibility, a program that is responsive to our rural culture. And so we really tried to tackle those things, because had we not, we would not have been able to fill our clinical positions, which usually have a vacancy rate of up to 9 months to a year.
Before this program, I've been a mom for the last 19 years, a stay-at-home mom that worked in the classroom, substitute taught some, and I would probably just be doing that because there was really no way I could go back to school, being way out here in Calaveras County, hours away. But with a program that just is on the weekend, 1 weekend a month, that's designed for the rural area, now I can do it. What we really looked at was ways that we could provide a college education that was accessible and respectful of rural culture. And so we started that by instituting 2 psychology programs at Columbia College in conjunction with Tuolumne County Behavioral Health. And the first one was a psychosocial rehabilitation course, and the latter was a peer support class. And these have now worked in conjunction to create a skills attainment certificate that is locally recognized as being the skill set needed to provide peer support for our consumer base, and that's those with mental illness and or substance abuse issues. And so by creating those programs, we've really created some leaders in our community.
I want to get involved in helping other people. I haven't worked for quite some time. And I really had no direction till I got involved in this program. And now it's like, it's just a given thing. This is where I'm supposed to go, and this is what I'm supposed to do.
Both the peer support psychosocial rehab certificate at Columbia and the Rural Mental Health Masters in Social Work program are one of a kind. They're the first time that a psychosocial rehabilitation course has been offered in 12 units with the types of supports that we are making available to our community, including the carpools and study groups and things like that.
Calaveras showed me that with a little help, you can help a lot of other people. So by them giving me that help, I'm giving back to them as much as I can.
We have taken a group of people who, if you asked them 2 years ago, you know, what's your role? They would say patient or client. And now I hear things like peer specialist, student, consumer leadership team member, and that's been the most satisfying result from that program. The Masters in Social Work program is also new because it's the first time that a MSW program has ever been offered with a rural mental health emphasis in Calaveras County. Without this program, I would not have been able to go back to school, and there would be no opportunity for me to work with the county, you know, in mental health or social services, because of the barrier of trying to get down to college when I'm living in the Sierra foothills. And so we're really looking at the principle of growing our own and creating a career ladder that will allow people within the community to really fill those positions as they become available in the future.
It's the greatest thing that's happened to me since I don't know when, probably in my whole life.
I was looking to help, to help other people, and I got involved in the mental health programs that they have. Before, I never utilized any of the programs. I would just see a therapist for my medication and stuff. And then I tried the program out, and I kind of liked it. My goal is to help, younger kids from making mistakes, to kind of show them that, you make a bad mistake, you could turn it around.
I just love Calaveras County. They've opened doors for me. They respect me. They've given me confidence. I'll never be able to repay them enough.